Doing here?
Yeah, let's give it a couple more minutes, see if anybody else jumps on, so we can go at the same time. But we'll go through this, kind of give you some training on it. Um, go through kind of the different uh things that you can do with it, and then see if it works for you, and just kind of get you more familiar with it. Kind of what we did before, but hopefully some more experience at it. You'll get used to it a little bit. How's that sound?
Yeah. Are these your clients that you've signed up recently?
Yep, yep. So with this, they loaded a bunch of clients on here from Agent Core. Some people have been I use for the excuse me. Some of these people I've used entered myself or um, entered separately. Okay.
Is this in Agent Core here?
No, this is the Medicare Center.
Okay.
So there's a couple things. It doesn't pull directly from Agent Core. So when you put somebody into Agent Core, it doesn't show up here. You have to kind of duplicate what you put in, which is a little unfortunate. Um, Hopefully, in the future that changes. Um, the only other thing that this is lacking is it's hard you can't there isn't a tracking method on here, so you can't track the application. But if you do the application, um, you should be able to go into, like, if you did it in Humana, you should be able to go to a Vantage and see your enrollment status there. But there is a lag between when they upload it here to the Vantage, or to UHC. So there does tend to be a lag. It won't show up the very next day. Um, so just take that into consideration. Hopefully, I think this will only get better, so they'll improve on certain things. But okay, let's just give it one more minute. See, I told Derek about it. He was like, he wanted to be in on it, but I don't see him yet. Have you talked to him this morning at all?
No.
Okay. Okay. All right. Okay. Well, let's get started. Okay. So you come in here, right? And you have a couple options here. You go to your name, right? And you have this drop down box, right? If you needed to do somebody for December, you'd hit this one. But everybody else is going to be here. If you contract with Kaiser, you're going to use the Medicare link instead of this one. And then if you want to do Medicare supplements, you do this one, the CSG app. You got that?
Uh-huh.
Okay. All right. I think we showed you this a couple times the other day, showed you how to do that.
Now this is on going on the Medicare Center.
Yep. Medicare Center. Yep. So if you go back, you can see it's over here in the left.
Mhm.
You can see Medicare Center. Now, if you don't have anybody created, you're just going to go new profile.
Okay.
If you've got somebody already created, you can just come in here and you can put their name in, and uh, and they'll show up once you search for them, right?
Mhm.
So you could do it that way. And let's see. Let's just go ahead and create a new profile.
This would be for a brand new person.
Right. What's your zip code? 973
93726. 93726. Yep. Now, this is what I'd be doing if I get a hold of a new person, correct, Kyle?
Right. Yep.
Okay. This is what I want to do. Yeah, this is excellent. This is what I need.
Put here.
So when I meet someone or at the little luncheon, well, we've changed it to Coco and Learn. And hey, Mr. Testa, uh, let's take a look and see how we can help you, right?
Right. Right.
And I do exactly this.
Now, if you've got their Medicare info, you can put it in there. You know, I don't have anything right now. But let me see if anything. Let's see. Let's go. December. Then you put in the address. What's your address?
4436 East San Gabriel. There it is right there, fourth
Yeah.
one.
So you start typing it in, you can see it starts filling out some addresses. You can go down, you can pick the one, and it'll just automatically fill it.
Uh-huh.
Do you want to put you? Why don't we put your Medicare number in here? Do you have it?
Do I have my Medicare number?
Yeah.
Yeah. You want me to read it to you?
Yeah.
9, K is in kitten, F is in Frank. 3, N is in Nancy, M is in Mary. 4, V is in Victor, M is in Mary. 8, 2.
Okay. Then you come down, you hit save.
Okay.
Now, if you haven't met with them before, you can go to the
Scope of
continue
appointment.
to scope of appointment,
Okay.
and it's just gonna send off an email for that, and I can text it to them. And then if
Kyle, is
they're
this being recorded?
yeah, yes.
How would I go back to it?
I'll put it on my YouTube channel and I'll email it to you.
Okay, excellent. Thank you.
But if they're right there with you, you can just click on the form here, and then you can have them check mark these and then basically sign, and you're done.
Yeah.
Okay, so pretty easy there. And if they're right there, you can do it. So let's say you did that, right? You got it done already. So you got your scope done. Now you're going to go to preferences. Now here, let's say if it's a VA person and they get their drugs through the VA, you could say medical only.
Yeah.
If it's somebody who has a Medigap plan but needs a prescription drug plan, you would hit prescription drug plan. If it's somebody that you think is Medicare Advantage with prescription drug plans, you hit that. Now this box, what this is asking is, do you know if you have any help through the federal or state government? Like, do you have Medicaid? They have Medicaid, you click that. They have supplemental insurance through Social Security, you click that. They have their Part B paid for through the Medicare Savings Program, click that. right? And you just kind of go through these and which ones, if you don't know, you can hit no, I don't know, or if you know that they don't qualify, you hit no, right?
Okay.
Well, let's say we think that they do get full help with Social Security, so we'll hit that. Hit continue. Now on this screen, you can hit their health needs. You know, if they have no major illnesses and less than 2 prescriptions, they're generally healthy. But if they have some health needs and have more than more visits to the specialist, you can say, hey, have some health needs. If they have some multiple conditions, chronic conditions like diabetes, you can hit significant health needs, right?
Mhm.
You can even estimate their medical costs. So if you do that, you can come in here. If you're talking with them, how many times did you go to the ambulance last year? 1. How many chiropractors? 1. How many times did you use the labs or radiology? You can, you can change this and edit it, and then update the answers. Okay. You can come in here, say 45 specialty. That seems a lot. We'll just say 25.
Yeah.
Inpatient hospital care, we'll say 5. And then you can save it, right? Okay. And then
This
hit,
is kind of, this example is, this person is pretty sick.
yeah, yeah. But I mean, yeah, not everybody's going to be like that. This is just, if they're not, so let's go back to that.
I mean, because they were going to, they went to the hospital 5 times.
All right. Well, we can, if they're not somebody that doesn't go, you could put in 0, right?
Yeah.
Don't care.
I'm just,
None.
I'm just trying to get the grip,
Well,
you know,
4.
how sick people are, what you could run into.
Yeah, everybody's a little different, so that's why you just ask them, hey, what's how many times do you go see the doctor? You just go through here and you just add them up. You just put them in. How many times did you go see the outpatient surgery? Probably not going 9 times. You probably went once. Skilled nursing, you just save it, right? So pretty easy.
Uh-huh.
And you can skip that part too. You don't have to do that. It may help, may not. And then here you can look for providers, right? You can type in a provider name. You can, let's just do a general name, see what comes up in Fresno for Smith. And it's going to search the area right here, which is where the zip code that we put in, the 93726. Okay, that's a dentist. Here's an ophthalmologist.
Yep.
Here's Rory Smith Family Vet Medicine. So let's hit this one, but he's in Fresno, so we'll hit that one. Okay.
Yep. Right down the street from me.
And then we'll say set primary care provider.
Okay.
Okay. Now you can put other ones in here if you see, oh, my ophthalmologist or my optometrist is Justin Smith, you can add him too.
Okay.
Okay.
What
And
about
then
dentist?
you could do dentist too. Yeah. And then from here you add drugs. So, you can say I take lisinopril. Okay, so you start typing it in, it fills it in for you. Then you say, how many milligrams do you take? Say, well, it's 30. You
Mhm.
take it once a day. Yes. You get a month supply or 90 days. I get 90 days. So then we have to adjust this because it's once a day. So 90 for the 3 months and you add it. Then you can add another drug. Maybe it's omeprazole for the heartburn, but I take a delayed release capsule, 40 milligrams, 30 once a day, add. Okay.
Uh-huh.
And then from there, you can add other ones if there's other ones. So let's maybe say Trulicity. Trulicity. Yep. It will automatically default to the most common dosage. So if they don't know, you can always go with this because that's the most common.
Mm.
All right, so that's all the drugs. So we're going to hit continue. And then we're going to ask what pharmacy do you get the drugs at? Brings up the pharmacies here. And you can go down and you can pick the pharmacy that you go to. Let's say Walmart.
Mhm.
If you don't see something here, you can expand this search so you can just
So
zoom out.
I'm asking them, where do you get your prescriptions at? Correct?
Yep. Yeah. Where do you go? Walgreens. So you could type in Walgreens.
Uh-huh. Know exactly where it's at.
And then it'll come up with different ones and then say, is it the one on First Street or is it on Shaw? Oh no, it's the one on Cedar, right? And you can click that one. And it clicks as primary. But if you want to if you want to see what different pharmacies might be, you can add another pharmacy, and I'll show you how you can do that later. So you hit continue. So now it's calculating all the plans, and it's going to show the plans that you are licensed for to sell. But you can show non-licensed plans. If you want to look at other plans, you can do that by just clicking this link right here.
But if I bring that up and they like something, then I'm kind of
right, right. So if you're doing this on your own, and you're just, they're not in front of you, you're doing this on your own, you just kind of want to see, you may add that. If they're right in front of you, yeah, you may not want to do that. Just show them the plans that you have, right? And so now it's going to bring up all the plans, right? The big long list of plans. But let me show you how you sort this. Now this is sorted by plan premium. So it's just going to list the 0 premiums, low to high. But you can also sort it by total estimated cost. And that's going to factor in not only what they pay at the pharmacy, but also what they pay on a monthly premium and what their health needs were. So that health survey that we did at first, it's going to calculate that. And that's what you see down here in the 1302 total annual cost. You could just estimate drug costs. If you're just concerned with drug costs, you could do it that way. And now it's going to sort low to high. What plan has the lowest drug costs? It may not have the best cost for everything, on the medical side. All right. And you can also do Medicare star ratings, plan names, deductible, max out of pocket. So just however you want to sort it. I typically use these two: total estimated cost and estimated drug cost, low to high. But whatever, you feel works. Now, when we're looking at this, I'm going to look at, the plan, of course. Does it have a deductible? What's the max out of pocket? What's the premium? But I'm also going to look at the providers. So I see the provider down here, right? So you can click on that and you can see who's in network. Oh, my primary care doctor isn't in network. Well, optometrist is, but not the primary, right? So this plan's probably not best for that person because my primary doctor isn't in network, right? So even though it has the lowest drug cost, that might not work for the person, right? Now, it shows that all 3 drugs are in the formulary, so I know all the prescriptions are covered. That's good. And I know that now that Walmart is a preferred network for this Aetna plan. So it tells me all that just in this one little box right here. Okay. And so I can go down, here's Aetna again. As you can see, there are a couple different plans, right? One's got a higher max, one's got a medical deductible, this one doesn't. There's going to be different benefits. That's estimating the cost. So that means that you will have, a 750 medical deductible, and you're exposed to more costs. So let's go down. Let's see if we can find one that has. Now, we didn't do very good on the provider, so we don't see, doesn't look like that Smith guy. Maybe he doesn't sell Medicare. I don't know. But it should tell you if they're in, which ones are in network and which one's out. This one doesn't have either one in there, so you're probably not going to use that. Now, you may, if this happens, you may ask him, how often do you go see Smith? Well, I don't see him. I haven't seen him for a couple of years. Well, do you want a new doctor? Yeah, sure, I could go see a new doctor. Then you know that you can always pick a new doctor for him, right? So maybe that's not a big concern. Maybe it is, maybe it's not, right? The other thing you can do is you can come up here and you can change the pharmacy. Okay. Now you can see the drug costs differ. This one's standard, but the drug costs are, 131, still one of the lowest for that. And then the estimated cost down here as well, because the max out of pocket's a lot lower than $5,000, right? Now you can compare these if you wanted to. You can hit here and then here, and then that takes you to a compare screen. You can have them side by side. And it just shows you, and you can just go side by side and how which one works the best for that client, right? And it goes all the way down. It goes through your doctors, which ones are drugs are covered, what's standard, what's primary, preferred network, right? If you want to dive more into details, you can go into plan details, and it will show, let's say you want to know exactly what drugs are covered where. You can go to prescriptions tab. You can see lisinopril, omeprazole are generics preferred, and then Trulicity is a brand name drug. Okay, so you want to see how that estimates throughout the entire year. This is going to break it down by month for the entire year, what the cost will be for the premium, how much they pay for their prescriptions, and then what their anticipated health costs will be. And that, again, that goes back to the survey that you did initially, right? And then it shows you what the costs are for the entire year. Now, this guy says, hey, this is pretty good. Testa likes it. He wants to go enroll. So then you hit add to cart. From here, it's going to ask if you want to add dental. You say not at this time. There's two options here. You could send the beneficiary to have them sign it and submit it. That means that it will email them or text them the application, and they can fill it out on their own. If they're sitting right there with you, you can say complete and submit form myself.
Okay.
So you hit that and hit continue to apply. Now this part is the same for all the carriers that are through here. So this is no different. You hit continue to apply, and now you're going to go straight into their specific enrollment page. So it's going to say you're being redirected, hit continue. And then you can go into the enrollment application itself. Are you with me?
Yeah. First,
Okay.
we went to MedicareCenter, and then we compared the plans, picked the, did a health assessment, did the doctors, prescriptions, and plans, chose which one was applicable and the payment. And then we selected to enroll them, and now we're being redirected to Humana's site.
It's not Humana's specific site. It's still, as you can see, we're still in MedicareCenter, but it is specific to Humana.
Oh.
Now, this portion will look very similar to all the carriers that are in the MedicareCenter, but there could be some subtle differences from each company to each company. They may ask different questions. So here you may put in Mr. You may have a middle name, so you type in the middle name. You put in their gender. Everything else is already populated, but they ask, is it a cell phone or a landline? Let's just say landline. Goes through your address. Now, if they have a PO box, you can put that down here. Otherwise, it's already populated. You just hit next. And it's got your performance bar up here. There's only 4 steps here. We're halfway done. We're in benefit info right now. So it populates your Medicare number. You're going to select the effective date. Ask, do you have other drug coverage like the VA or something else? This person doesn't, so hit no. And then you just hit next. Now this is where it gets kind of funky. You do have to select a primary care doctor. It is optional, okay? So if you don't want to, you could hit no, right? Because let's say we couldn't find the doctor, right? And so you could say no and then just move forward. Or you can say yes, and then it's going to ask you, what's the primary care physician's name, or what's the clinic name? And if you don't know, you can hit physician search. So you just go that, and that's going to take you to the Humana site directly to do the provider search. As you can see, you can do a medical search, you can do dentist, you can do vision, you can do pharmacy. And you just type in the zip code. You're just following along with the screen. You can do distance. That helps sometimes because sometimes the doctor is further out, works at a different location. So to get a clearer picture, you usually do a larger radius. Here you just select we're doing Medicare, right? It's not insured through the employer. We're doing Medicare. So we're going to hit Medicare, and it's in 2023. Eventually this will be the only option because 2022 only lasts another, 9 days. Most of these are going to be 2023. And then you select the network. Now this was an HMO Gold Plus HMO. It's not the SNP plan, so we're going to hit the Gold Plus 23. It's not Honor, which is the veterans one, and it's not the PFFS. It's not a PPO. It's not employer, right? So we're going to hit this one. You hit select. Here you can go by name. If you know the doctor's name, you could go by name. If you don't know those, you can go specialty. And then over here, you can put like primary care. And then it pulls up a drop down, right? And you can just go down, hit all primary care physicians, and then hit search. And now it's going to bring up all of physicians' primary care that are available according to that zip code and that radius, right? But we want to make sure that person's accepting new patients, right? So we're going to click that box here. We want somebody that's really good, cost efficient. And then we want somebody that's internal medicine, maybe. Right? And then we can come down here and filter results. And if you wanted to do gender, you could do gender. If you want to do languages spoken, you could do that. There's a lot of different ones, right? And then from here, what we're looking for is this number here, primary care number. So you just kind of copy that. And then we go back to our thing. We put in, who is it? Carl Arun. Carl Arun. And then we put in the ID number right there. We're new to that physician, so we say no, we're not established. And then we continue on. How do you want to pay for your plan premium? Well, I get my Social Security will come out of that. Yes, it's a 0 premium. So there's not going to be any cost, but let's say if there was, we could have it taken out of Social Security. You have them read this, or you read it to them. You go through, you know, language is going to probably be English, right? Probably maybe large print. I'm not a veteran. In this, you can just either leave blank, or you could say it was from my cocoa and coffee event, and you can say event, and then you hit next. You with me?
Yep.
Okay. Now here, we're all done. All we're doing here is we're just going through the information and making sure it looks correct. If it's not, we can hit an edit button right here, and it'll take us back to this page, and we can edit at that point. But you have them kind of read through this, make sure it looks all good, right? Carl Room, yes, that's my doctor. Yes, great, great. Yes, Social Security, confirmed. Yes, then they read this, all this legalese, this disclaimers, right? You know, you can read through that. And then some of it, like this stuff, they're not a dual eligible. They don't need to read that. They can skip over that, right? And then they come down here. All they have to do is, I understand that my signature or the signature of the person legally authorized to act on my behalf on this application means I've read and understood the content of the application. And so they click here. They say, I'm the person listed on this form. I am Testy. And then you come down here and they can sign their name in the box, either the mouse, or if they've got their finger, they could use their finger. And then you come down here, there's a few other things that they need to fill out, like, do you give permission for Humana to contact you? No, no, thank you. No, no, no. And then submit. And by submitting, they're agreeing to enroll into the plan. And then it shoots it off to Humana. Humana will get it. They'll process it, send it off to Medicare, Medicaid, and there you go.
How long does it take for them to take effect and them get a card and start going to a doctor?
Well, the effective date, it depends on the effective date, right? If you're doing this 3 months in advance, it's going to be 3 months, whatever that effective date is. It will take about 7 to 10 business days to get a welcome kit with the card in it. And so there is some time there. It will take about 2 weeks for them to get that. If you have somebody that, hey, they're enrolling and tomorrow's the 1st of the month and that's their effective date, you know, they're not going to get their card. And if they have to in time, if they have to use it like on the 2nd, you know, I can walk you through how to get that information to that person to get it covered. Now, so let me close this out. So let me just show you, and then at the end of this, there'll be, you can email a copy of the application to them. So you can do that. And then there's also the health risk assessment. You can click on the health risk assessment. You can ask them a few health questions. and you get paid for doing that assessment too.
Where do you click on for the health?
I can't show you that because I'm not going to submit this because I don't want this to be submitted.
It comes up after the submission.
Yeah, you'll see it. You'll see it. It comes up. You'll see it.
Okay.
It's pretty. It's right in your face. You can't miss it.
Okay.
Let me show you. So this is one that I've recently done. And so I can come in here, I go back into that profile, that person.
Now this is one of your clients, right?
Correct. It's got my notes over here. It says application was sent. I've done a couple different applications. I've done the SOA, right? And then it comes down and here's the enrollment history. They were on this plan, but they were on this plan. And then we recently put them on this plan because they moved. And I've got a confirmation number right here, and that's all stored here. So if I ever need any questions, if I ever have to go to Humana and say, where's my app? I could call them up and say, here's my confirmation number. How is my app been processed, or are there any pending issues or anything like that? So you've got everything all in here. And then you do what I do is I do take some of this stuff and I put it in Agent Core. So I have a file on them in Agent Core. So there is some duplication there, which, is unfortunate. I mean, it would be nice if they talked to each other and I didn't have to do that. But I do that just because it's easier for me to have that stuff in Agent Core to look up. But next year, if they come around or if they move again, right, I have all their information stored here. Their drugs are in here, their doctors are in here, and whatnot. So it's all saved in here for you, and you can go back to it, right? So you don't have to worry about paper apps or getting it in or faxing it in. It's already gone. It didn't take very long. That application process probably took maybe 15 minutes. Once you decided on what app or what plan they were going to do, the application itself really didn't take very long, right? So, and you have it all in here. And so next year, come annual enrollment time, they're already in here. I can go in here and edit their preferences if I need to, like the doctor changed or the meds changed. And I can go specifically to that, and I can see what their meds were. She didn't have any, but that's okay because I didn't want you to see her meds anyways because that's a HIPAA thing. But yeah, any questions on that?
Not really. I just want to go over it, again, 20 times.
Okay, so what you can do is you can go in here on your own, put yourself in there, and just play around with it.
Okay.
Use it as a learning experience. Do different things. Do different health requirements. Do different doctors. Get used to it so that you get comfortable with it. And
I could go in and do the non-licensed, just kind of experimental, look and see.
Yeah, let's say you don't know, you have a new lead and they're in Oregon, right? Somebody says, hey, I'm moving to Oregon, John. Can you help me out? Okay, where are you moving to? I'm moving to Clackamas, right? So you just put in their zip code, get shop plans, and you'll be able to see what plans. Now you have to be licensed in Oregon, right? You're not licensed, but this is just an example of what you can do. You can hit non-licensed plans. You can take a look at all the plans that are available in Clackamas.
It'll be a bunch,
Yeah. And you can do the preferences and stuff, but you can get an idea. Okay, Aetna or whatnot, or a better example is probably Santa Barbara. What's Santa Barbara's zip code?
Oh shit, man, you got me.
Okay, but you can do that on your own, right? So just those are things that you can do. You can, if you just want to see just the plans without prescription drugs, the Patriots, Honors, that sort of thing. You can go through that. You want to just do prescription drug plans only, you can look at that. You know, you won't have Medicare supplements on here, but you wouldn't want to use that for this anyways. So you would use the CSG app for that. Okay.
Yeah, how do I access this now? Again, this training video.
Okay. I'm gonna stop recording